My name is Joy Falkenburg. I work at Monument Health in Custer. I have been here since 2000. I went to the University of South Dakota Medical School. I graduated from there and went to the residency in Rapid City for family medicine. I am a specialist in family medicine. I practice everything from prenatal care to obstetrical care. I do pediatric care. I work in family medicine with internal medicine, and I also do hospital and ER medicine. So I've been here at Custer Monument Health since I graduated residency in 2003. So I have always had a love of family medicine because my oldest sister is a family medicine doctor, and I see patients as a whole lifespan of care. I am very intrigued with taking care of people from the time that they're born till the time that they may have a natural death or unfortunately an accident or another illness, and I wanted to be able to impact the trajectory of their life. So family medicine was always a calling. I also grew up in rural Edgemont, 30 miles from town, and the only types of doctors that we saw from a very far distance even then was family medicine. And I really always respected like the traditional family medicine that could handle anything. You brought your ailments to them and they sorted it out and they helped you with it. I joined Rapid City Regional Hospital's residency program back in 2000. And in 2003, I knew that I wanted to come to Custer. And my plan all along was to actually come to Custer. I had that plan since I was a sophomore in high school. My mom suffered with polycystic kidney disease, and I wanted to impact the care of the people in the area clear from Chadron, Nebraska over to Wyoming and into western South Dakota. So I knew that Custer would be my home base, and I started working towards that from the day that I applied for medical school. Monument Health is the organization that services this area, and I wanted to work with them to create an excellent care environment in this surrounding area so that people could get Mayo-like care locally and be taken care of. The most rewarding part of my practice is my relationships with patients and the community. So I really believe I'm much more of a healer than just a doctor or a doctor. I believe that when you take care of a person as a whole mind, body, spirit, and you know them deeply and you're really interconnected, that you can care for them in a much different way. I like to practice in a way that I marry Western medicine, which is how I was trained, with Eastern medicine that takes a more holistic approach. And I think that we are impacted by things physically that may be a mental ailment or or something that's a spiritual crisis. And so for me, the relationships that I can build with people over time will make them healthier over their lifetime. And it's not a unilateral relationship. The relationships I share with people, they give me love, I give them love, and we, through that, heal each other. So the relationships are the way I do it. So the Black Hills have always just been something that I really enjoyed. Coming from Edgemont and the flatter area, I really love the granite outcroppings, both winter and summer. And I am a gardener. I didn't grow up gardening, but have now practiced that for 20 years. I have a little hobby farm that has ducks and chickens and pigs and cows and cats and dogs. And I love to garden, and I love to create a healing environment so that healing can occur. So I work with the healing garden at the Custer Hospital. I personally have a huge garden and a little hobby farm that I love, and I love seeing my children grow and working with them on that.